It began when Paul Elwood convinced us that we should do an experiment. We owed it to the community to do that.
The marketplace changed. Financial experiments in the delivery of healthcare changed the relationship between the pharmacist, the physician, the patient, and the payer. Simultaneously, clinical pharmacy was growing through the leadership at the University of Minnesota. And leaders like John Middleton saw these changes and really used these changes to create a new industry, the pharmacy managed care industry.
Some of these principles go back some 35 years or thereabouts, and I happen to be the executive officer of the Minnesota Association at the time that these changes were taking place.
I think it all started back in the mid-70s when I became the assistant executive director of the Minnesota State Pharmaceutical Association. Don Dee was the executive director, and I went to work with Don. During that whole process of working on that pharmacy component, I met some other gentleman. His name was Rich Burke, who was the principal of Charter Medical Development out of San Antonio, Texas.
What happened, perhaps serendipitously, but certainly fortuitously, is that the pioneers that were being trained to be clinical pharmacists were trained with physicians here. The education that the College of Pharmacy wanted them to have was available in some of the medical school classes. And so the pharmacists and the physicians of the future were actually being trained side by side. I think that it goes back to the point of physicians and pharmacists working together. By working together over time, there are fewer barriers in this state that have evolved for healthcare change than there are in other places.
There's no doubt that the change in the curriculum at the colleges of pharmacy, moving towards a clinically based educational experience for the pharmacist, made all the difference in the world. Because the physicians that we dealt with had to believe that there was a knowledge of the clinical environment, there was a knowledge of diseases, knowledge of labs, knowledge of everything that went into a patient's care.
Leadership grew in another direction under the leadership of Albert Wertheimer at the College of Pharmacy. Albert built the Social and Administrative Pharmacy department, and there were many graduates of that department that studied the effects of managed care on the practice of pharmacy. Fred Curtis, Andy Strigakis, and one of the early entrepreneurs and an early adopter was Dave McLean. I mean, David McLean is an entrepreneur. He was able to merge the ideas and concepts of pharmacy technology.
Technology in many ways is like a formulary, because if a formulary is correctly constructed and then applied correctly, you get better results. Our solution wasn't to say you can't use those medications, but rather to educate the physicians as to when those medications were appropriate and when they weren't. And because the physicians had involvement in this, they were interested in doing that.
John Middleton was a guy that I hired to run the pharmacy component of Physicians Health Plan.
I look at the results that we've been able to have in delivering optimal care, particularly in the area of diabetes, and that's a really great example of the common space between medical care and medication therapy management. Optimal care for patients with diabetes is all about effective use of medications.
There was a lot of pride in being associated with Minnesota Pharmacy in those years because Minnesota Pharmacy was leading the nation in the development of what subsequently became managed care pharmacy.
3 of the founders of the National Association Academy of Managed Care Pharmacy came from Minnesota: Hank Blissenbach, Robert Navarro, and myself. We were three of the 8 and really played a leadership role in creating a national organization. Lowell Sterler, Richard Zabinski went on to become presidents of this organization, and Robert Navarro is still publishing the Managed Care Principles edition. So it's a fantastic opportunity for us to have a national presence.
The early years of managed care in Minnesota, and a lot of that came about because of the support of the professions, the health professions, both medicine and pharmacy specifically. And I think that the reason that pharmacists got involved to the degree they did was that under the leadership of Don Dee, who is the CEO of the association, he saw an opportunity here to really advance the practice of pharmacy into a different way of practicing through managed care. He had good relationships with medicine. Associations had great relationships. They met routinely. Don had a great relationship with Rich Burke, who was at that time PHP's CEO. We had a man on staff at MPHA, John Middleton, who was also a visionary and saw the opportunity. And we had pharmacists who realized that they couldn't continue doing things the way they were doing it. And so all of these came together to say that, you know, there's an opportunity in managed care. Let's propose to PHP that MPHA, the association, develop a network and manage this network.
And then you look for that leadership, because the leadership needed to be there. The leadership needed to be there both in terms of dealing with the physicians, very important part of the success that we would have as we were managing a pharmacy benefit management for a customer, for a client. Leadership in terms of dealing with the other individuals around that payer environment and around our company, a PBM company.
We set up our formularies probably in the early 80s. I worked with Bill Apple's group, was instrumental, and that's basically where Albert Wertheimer and Bill Apple and Jim Bartilla, and in that process I met also Bob Navarro, who had just come on, I think, with that same practice group, and Bob was working with us on the formulary, and it became clear at that point that it was time we take somebody in-house. So that's when we started hiring the clinical pharmacists.
Successful, long-term game has got to be about putting patients and consumers first.
For Hendrickson is ready. Hendrickson.
If we don't have that end in mind, I think our business models will fail.
The cost of prescription drugs is the focal point of everybody, be it payer, be it patient, be it physician, whatever it is. And so there certainly is an opportunity to manage those costs the same we did years ago without affecting quality of care. I do think that because of now the increased pressures on those costs, and because there really is less and less money to pay for it, the knowledgeable, the experienced, the credible pharmacists in the managed care arena is going to be able to make even more decisions and be a bigger part of that healthcare decision team.
The Center for Leading Healthcare Change was developed to really put emphasis on carrying out what is a legacy for this college of leadership. We have produced many leaders, and we felt that it was essential that we carry through that legacy with the people that we have produced and looking at future practitioners.
I think leadership in managed care, as leadership in the profession, requires several things. One is it requires an ability to see how large the world is and to recognize that different people and groups in the world have different needs, and those needs need to be addressed in a different manner. I think it requires the ability to step out of one's comfort zone. We're all trained as clinicians, and to move beyond that is a difficult transition. The skills that we learn in College of Pharmacy translate very well both to leadership and to management of benefits and so on. medication therapy management is the future for the practice. I think it's also the future for the pharmacy benefit for managed care. And I think that MTM will bring pharmacists and managed care into a much closer working relationship because we have a shared mission in that.
I think that there's a big role for the pharmacists if we can build them into the loop so that they are seen not as secondary in terms of filling the prescription, if you will, but really primary in directing the utilization of the correct medication and gaining patient compliance.
I think there's a great future for our organization and particularly for the School of Pharmacy, because I think we're just now starting to understand the capabilities of the health professionals we work with. And I think our organization has had a good history of linking pharmacists and physicians pretty effectively, but I think there's even more to be done there.
The pharmacist who learns how to interact with the patient at a level where they can connect and actually change behavior in the patient is a model that will sort of allow a theory to become a practice.
What is leadership? A leader is someone who moves the frontier, who creates momentum, who creates change, and allows other leaders to follow. John Middleton was the first PBM pioneer, the first among first. He created an industry, other leaders followed, and today the pharmacy benefit industry has a life of its own. It totally is driven by new leaders, new thoughts, and it has an impact on the way healthcare is delivered in the United States. It is truly an industry to be proud of.